Hi, this video is a guide on how to get started with exercise following your heart procedure or event and to minimize the risk of a second heart attack. After your heart procedure or event, lifestyle modification is highly recommended. Improving your lifestyle helps to better control risk factors such as high blood pressure, high cholesterol, and diabetes, hence improving heart health. What is cardiac rehabilitation and why is it important? Cardiac rehabilitation is a program designed to empower you with knowledge to improve your heart health after experiencing a heart event, as well as to integrate this knowledge into practice. Phases of cardiac rehabilitation. Cardiac rehabilitation can be categorized into an inpatient and outpatient phase. The inpatient phase is the cardiac rehabilitation phase that is recommended to take place in the hospital early, after one's heart procedure or event. The goals of the inpatient phase include chest physiotherapy, early ambulation, and planning for a safe discharge back home. You will receive advice from a multidisciplinary team on lifestyle modification towards recovery. You will also be taught how to start exercising at home safely. NUHCS offers a cardiac rehabilitation program for the supervised exercise outpatient phase of cardiac rehabilitation for all suitable patients recovering from a heart event. You are highly encouraged to enroll into this NUHCS cardiac rehabilitation program, which is a structured group exercise program guided by trained physiotherapists to help you understand the basics of exercise prescription. These exercises are tailored specifically to the results of your assessment, which will be conducted upon enrollment of the program. For more details, please contact your cardiac rehabilitation case managers. In this video, we will focus on the exercise component of lifestyle modification. It is essential to maintain an active lifestyle with at least 150 minutes of moderate intensity exercise per week. How is exercise going to help me? Exercise is a key cornerstone of lifestyle modification. Regular exercise helps to lower blood pressure, increase good cholesterol, decrease bad cholesterol, and improve blood sugar control. Exercise also improves fitness, as well as controls body weight. All these benefits contribute to reducing the risk of chronic diseases and prevent heart problems from recurring. Now that we understand why we need to exercise, how do we go about it? Typical exercise routine. Generally, a typical exercise routine after a heart procedure or event starts off with a warm-up, followed by aerobic or resistance exercises, and ends off with a cool down and stretches. Warm-up. Warm-ups are important to gradually increase your heart rate and prepare your body for the exercise. It is recommended to warm up for 5 to 10 minutes before your exercise session. Some forms of warm-up may include low-level aerobic exercises like marching on the spot or slow walking. You can also do some stretching to improve flexibility and minimize the risk of muscle injuries. Aerobic or resistance exercise. This is followed by the actual exercise, which can be split into aerobic or resistance exercise. This will normally last for about 30 to 60 minutes. However, it is advisable not to overexert for 1 month following a heart procedure or event. Abstain from vigorous exercises during this period to allow your heart to rest and recover. Do note that you should not lift more than 10 kilograms for the first month after your heart procedure or event. Recommended home aerobic exercise after your heart event. Aerobic exercise is the primary focus after a heart procedure or event. It can help to build strong heart and lungs, increasing your cardiovascular endurance and fitness. Examples of aerobic exercises may include brisk walking, cycling, and running. To prevent overexertion, you are recommended to start walking immediately after discharge from the hospital. It is a low-impact aerobic exercise that can be done anytime and anywhere. As a general guide, you may start off with 5 to 10 minutes of continuous walking at a normal pace. You should aim to walk daily, at least twice a day. Increase the walking duration by 5 minutes each week. You should be able to achieve half an hour of continuous walking by the end of 6 weeks. Work on progressing your exercise in this order. Frequency first, then walking duration, followed by walking speed. Cool down. The exercise routine then ends with cool down movements and stretches. Cool down movements allow your heart rate to decrease gradually, while stretches help reduce post-exercise muscle soreness by flushing out toxins which could have built up in your muscles after exercise. A demonstration of common stretches will be shown at the end of this video. In the next segment, we will teach you how to monitor your exercise intensity, so you know how to exercise safely and know when to progress to meet the recommended level of 5 days of 30 minutes of moderate aerobic exercise. Evidence has shown that moderate intensity exercise produces health benefits while minimizing the risk of complications. There are 3 ways to help you to evaluate the intensity of exercise. 1. Through a walk-talk test. 2. Measure your target heart rate with a heart rate monitoring device. And 3. Use of the Borg rating of perceived exertion scale. The walk-talk test. It is normal to feel warm and break into a sweat while exercising. Your breathing will be deeper and your heart beats faster than usual. To know if you are exercising at a moderate intensity during the walk-talk test, you should notice that you are able to hold a conversation but not able to sing. Or measure target heart rate with a heart rate monitoring device. We would recommend you to measure your heart rate during exercise with a heart rate monitoring device. Do check in with your physio regarding your personalized moderate intensity target exercise heart rate. The other method to subjectively evaluate exercise intensity is to use the Borg rating of perceived exertion scale or RPE scale. The Borg rating of perceived exertion measures the intensity of physical activity. Perceived exertion is how hard you feel your body is working. The scale goes from 6 to 20, and you are recommended to remain in the green zone, also known as the target exertion zone. The recommended target exertion zone falls within the rating of 11 to 14. In this zone, you will be feeling some exertion and deeper breathing while exercising, but will still be able to have a conversation. If your breathing is comfortable or light, and you can sing a song without effort while exercising, your perceived exertion zone is now in the blue zone of 6 to 10. It is recommended for you to increase the intensity of your exercise if you are in the blue zone. If your breathing is getting forceful or uncomfortable, and you are no longer able to carry out any conversation while exercising, your perceived exertion zone is now in the orange or red zone of 15 to 20. It is recommended for you to scale back on the intensity of your exercise to keep within the target green zone and prevent overexhaustion. When is special care required during an exercise? After understanding how you should exercise for maximum benefits and the different ways to evaluate exercise intensity, it is also important to always practice care during your exercise. As a cardiac patient recovering from a heart event, it is important to know the signs and symptoms of a heart attack so that you can seek medical help promptly. Common signs and symptoms of a heart attack. Signs and symptoms of heart attack include chest pain or tightness, breathlessness, cold sweat, dizziness, nausea, or vomiting. If you experience any of the above symptoms, stop exercising immediately and rest. Check if the symptoms resolve or get better with rest. If symptoms persist, or if your pain level is 6 to 10 on the pain rating scale, please seek medical attention immediately. Bring along your GTN medication, also known as glycerol trinitrate, with you whenever you exercise. Should you experience chest tightness or discomfort, please stop exercising immediately and consume your GTN. Special care for diabetic patients. Individuals with diabetes will need to monitor their blood sugar levels before and after exercise. Do not exercise if your blood sugar level is lower than 6 millimoles per liter or higher than 16 millimoles per liter. Hypoglycemia, or low blood sugar, may occur during exercise as blood sugar levels drop with exercise. Common symptoms of hypoglycemia include sweating, trembling, clammy skin, dizziness, excessive hunger, and generalized fatigue. It is recommended to bring along emergency carbohydrates such as sweets or cream crackers with you during exercise and consume them should you experience these symptoms. Also, remember to check your feet hygiene to make sure that there are no open wounds, as diabetes is linked to poor wound healing. General tips before exercising. How should you prepare for your exercise? Make sure you wear appropriate exercise attire and footwear. Avoid wearing slippers to prevent tripping and falling. Have your meals at least 1.5 hours before exercise, and medications at least half an hour before exercise. Drink enough water during the course of exercise. Avoid exercise if you are not feeling well. Avoid vigorous exercise and consult the doctor or physiotherapist if unsure. Finally, remember, it is never too late to start exercising. So let's get started today. Do consult your physiotherapist if you have any questions about this video's contents. If you are keen to find out more about how to progress your exercise after the first month following your heart procedure or event, or if you would like to return to higher level sports, You are strongly encouraged to enroll for the NUHCS Cardiac Rehabilitation Program via your Cardiac Rehabilitation Case Manager. A demonstration of some warm-up and cool-down stretches will now be shown for your reference. Thank you.
Hi everyone, today we will be demonstrating some exercises that anyone can follow. These stretches will enable you to loosen up your body before you start exercising, as well as cool down after you have completed your exercise. So if you're ready, let's get started. We have now come to the end of our activity. You may now proceed with your regular exercise. Regular exercise is very important for the prevention of heart disease, and for those who are already living with heart disease, it is even more important that exercise can help you stabilize your condition, make you feel better, feel stronger, and prevent repeat hospitalizations. We hope you have enjoyed this activity, and please share widely with your friends and family. Wishing you the best of health.